everyone. Hopefully everyone can hear us all very well and good. Thank you so much for joining our fourth RUH Live webinar series. And it's all designed to connect the RUH staff and supporters together. So thank you very much. It has been obviously crazy times in this COVID, and it's so lovely to be asked to join you today. Personally, I've always tried to support the amazing RUH, our local hospital here, having given birth to both my boys there, and many moons ago, actually my mum used to train and be a midwife there. So it's really lovely to stay connected. So today's webinar is going to be a big opportunity to learn about one of the hospital's less visible but very essential departments, the pharmacy team. So we will get a chance, definitely store up any questions in your head. We will get a chance to ask them at the end. So if your little housekeeping note is to put any questions into the chat box as we go along, and we will make sure, fingers crossed, if we don't talk too much, there'll be time for them at the end. So thank you so much for all joining, all the support from the community and local businesses and people. And although I can't see your faces, hi if I know any of you. So anyway, it's now time to introduce today's panel, who, first of all, I have to say congratulations to on being awarded the RUH Team of the Month. Woohoo. So we've got Uzo, Carrie and Rosie here today. I'm going to ask each one of you to say a little word about yourself, because you can introduce yourself better, and it's just slightly embarrassing having to say those lovely things about yourself. So first of all, I'm going to say, Carrie, please just introduce yourself and what your role is.
Hiya, yeah, I'm Carrie. I'm the training and education lead at the hospital. So anything to do with training and development and looking at all different roles, that's my job. I look after all that.
Brilliant. And then Uzo, what's your main role?
Yes, hi everyone, and thanks for having us, Amy. So I guess I'd say my role is actually supporting people like Carrie and like Rosie to, to do their job, to work and to get the best for our patients. We have a huge number of pharmacists here and technicians, and it is really a huge team. So yeah, that is my job, supporting people to do what they do.
Amazing. And Rosie, how about you?
Hi, so I'm Rosie. I'm one of the pharmacists. I work in cancer services. So I head up a team of pharmacists and technical staff who work preparing basically treatment for cancer patients and the inpatients having cancer treatment or attending the ward. So
amazing. Really important job. So we'll come back to Carrie. Tell us what drew you to the RUH to begin with, and what do you love the most about working there?
So I came to university in Bath, so the city, I have to say, and then I went away. I went to Chichester, so another small town. But I was looking to come back. I met my partner here, and so looking to come back, and then my dream job drew me back. It came available, and I got it, and that's why I'm here, because it's really what I want to do. Yeah, that's
brilliant. So yeah, a long enough time to feel settled in. And Uzo, you're quite unique because you only joined 3 months ago, didn't you? And how was that sort of joining amongst this kind of crazy time?
So I actually joined a year and 3 months ago.
Oh, a year and 3 months, sorry.
Yeah, I think my family moved down here about 8 days before the first lockdown, just to give you a sense of timing.
Yeah.
And what a year. So yeah, I think there's loads that's been changing. Obviously I think from my point of view, and I was saying about supporting everyone to do what they do to the best of their abilities, I think how we, looking out for each other over the last year, I think was just by far the biggest thing. And, coming out of last year, I think how we're able to support all our colleagues to still be here today was probably, I'd call that the height of our achievements. There are many others, but that was the biggest thing. And just pace of everything. It's been incredible.
Yeah, I think that shows the testament of your team, really, that you've managed to, settle in even in these kind of crazy, mad times. And I mean, Rosie, you've been, do people call you the mother hen? You've been there so long.
No, I think it's probably more the old grandmother rather than the mother hen.
They do now.
What kept you there? What's the one thing that you absolutely love about your work that clearly, you're still there?
So I think I have to say two things. So I said I work in cancer services. The thing with cancer services is there's always something new. If we look at cancer treatments, there's probably about 80% of those treatments weren't available when I first started working here. So every week there's something new that you've got to get your head around, work out, are we going to be using it? So the pace of change is something I enjoy some of the time. Sometimes I enjoy it less. But then the other thing that you have to say is the people that you work with. The pharmacy team is a great team, but also the rest of the hospital. I've worked with some fantastic people and I still work with some fantastic people. And everyone's very supportive of everybody else. So it's, I've been here 37 years, nearly, not quite, getting there. And I don't think I've been here for that long just because nowhere else would have me. I think it was, it was a choice decision to stay here.
Yeah, I think that's absolutely, incredible. And it just goes to show what an incredible place the RUH is, and the people, the staff, the building, the whole thing, isn't it? That becomes one sort of living being. So coming back to you, Carrie, can you tell us what your typical day might look like in the pharmacy?
Yeah, so it really depends on what type of pharmacist or technician you are. So there's loads of different types. So we've got a brand new post, a clinical academic post, that they'll be split between the university and here. We've got an operations team. We've got collaborations with other departments as well. But a typical clinical pharmacist would be that we would go up to the wards, work on the wards to just make sure that each prescription that's written is really safe, and that we make sure that all the medicines get to the wards and they are safe and legal in the legal framework that are set out, to make sure that the patient care is optimized to the best of our ability. So that's your kind of core thing, and then we've got lots of other things that we do as well. So I could work on the wards first thing in the morning. I could then come into dispensary and be in dispensary preparing the medicines. And I could do medicine, I could do surgery. We're flexible trades, really.
Yeah, you've got a lot of things to do, actually. Is there something
Absolutely.
that would surprise us that you do that we really wouldn't know about?
To be honest, I think the fact that we go and we work on the wards, and we are on the wards, we're quite present there. That I do know that when I tell people that, they go, really? What do you do on the wards? Because they see us in white coats behind a counter sticking a label on a box. And we're really not. We're there, we're giving advice, and we're talking and discussing patient care with the doctors and the nurses. And we're kind of the go-between between patients, doctors, nurses, physios, occupational therapists, and trying to get people home and that sort of thing. So, I think that does surprise some people.
Yeah, the actual human contact, so to speak.
Mm-hmm. Yeah, absolutely.
Yeah, that's good. And also for you, your team were very influential in delivering the staff vaccination program, which took place earlier this year, which has now been completed. Now, before I ask you a question about that, we've actually got a short video clip, which, if this, fingers crossed, should work. We'll all take a look at that first.
The vaccine comes in through the doors on my right, and our procurement and distribution team sort through them, do the quality checks on them that are needed for these medicines, ensure that the batches are right and safe for our patients. They need to be kept a very fairly special temperatures depending on which vaccine we're looking at, and they're kept in here until we transport them to the education center. A lot of time is spent on the quality assurance of the products, the checks that go into them, the monitoring of them, and the timing of when we move them between pharmacy and the education center.
Amazing. You kind of forget actually how obviously all the different vaccines need to be in very different temperatures, and you see, you know, how they're even stored. I mean, you must be so proud of your team. What has it been like for you to deliver all of the vaccination program on top of everything else that you do in your day job?
I go so far as say it's been, from a personal point of view, it's been inspiring. And I look at my, look at the pharmacy team, and one of our colleagues from the aseptics units who are not here on this call, but just what, as you say, what we've been able to deliver at the same time as the core services and all the other bits around quality. It's been absolutely incredible. I think for context, we prepared somewhere in the region of 28,000 doses of vaccine between January and April purely on site. And, and now the team is now supporting the large vaccination site in Bath. And, I get to sit here and say I lead this team, but they're just absolutely incredible. So, I think I'll call myself a lucky person for the team I inherited. It's been absolutely incredible. Absolutely incredible.
And were there any kind of big challenges that you had to sort of come over, or surprises that sort of popped up?
Constantly. And to be honest, that's just a day in the life of, in the workings of pharmacy, because at the core of it, we are a support service. So we're supporting everyone from cancer services to every ward, to the emergency department, to nuclear medicine. And I know I said my job is to help everyone do their jobs, but I guess my job is working with a senior team to tie together all the different priorities and make sure, because at the end of the day, there are about 120 people working pharmacy doing, I'll say we have about 8 different teams, and it's how do we tie everything together while remembering, we have to look out for ourselves and take care of our staff. So it's incredible. It truly is. It truly is.
Well, I was going to ask how many people you had around you in your immediate team or in the whole department.
Yeah. So at last count, 128. And as Carrie mentioned, we're constantly looking at new ways that we can, very innovative ways that we can work and contribute to healthcare, because at the end of the day, we're not here as pharmacy, we're here as providing healthcare to the people about. I think similar to you, Amy, this is my local hospital, so absolutely want to do everything and we all want to do everything in our gift to make sure that we're providing the best service possible.
Yeah, of course. Now, I guess for you, Rosie, we've heard that you've been in your post for a long time. What are some of the things that you've changed, seen as changes? And even, I guess, for you, the building's developed massively. I mean, even every time I ever come on up, there's like a new car park or something. So what have been some of the big things that you've seen develop?
So the big changes over the years, obviously the drug treatment has changed massively. It's just beyond all recognition, which has a big impact then on our ability to treat cancer and our cure rates from cancer. So that's one of the changes. The workforce has changed quite significantly. So we have pharmacists who act as prescribers in clinics supporting the clinicians, and that's a really important, and it's a very much a growing role. So we've got one prescriber, we've got another one who's just qualified as a prescriber, we've got another one joining us in 2 weeks' time as a prescriber. And that, like I say, that's a really valuable way of us actually just managing the workload that we have to do. The workload is something that is always a challenge because it's forever increasing. Unfortunately, cancer is one of those diseases which lots of people are going to come into contact with. It's fair to say, it seems as though it's becoming more common. I don't think it's that. I think it's just people live longer. And also, because we're so much better at treating cancer, we're treating patients for much longer with cancer, and we're treating them with ongoing treatment rather than short courses of treatment. So those are big changes. And then with COVID, we had suddenly to make major changes. We had patients who were no longer coming to the hospital, and we had to work out how we were going to get their medicines to them. So we had to set up a delivery service. So some of my pharmacy colleagues suddenly had to do that really quickly. We trained patients to self-administer some of their treatment so that rather than having to come in for weekly injections, they could just collect their injection or have it delivered to them and then do that themselves at home. And we're still, obviously, there's lots of changes ahead. There's going to be the new building. We're also looking at different ways of how we deliver treatments to patients, because lots of people don't want to be coming to the hospital every time to have their treatment. So it's what are the things we can do to treat patients closer to home. So those are sort of developments that we've still got on the horizon. And coupled with that, it is like every week there's a new drug treatment around the corner that obviously everyone's very keen to get implemented quickly, because we want patients to have access to the newest and the best treatment. So, you know, it's those constant challenges of something new. But at the same time, that's the thing that I think is great about, I mean, to say that it's great working in cancer services is probably not the best thing to say, but it's got, you know, as a pharmacist, it presents you with some really interesting challenges. So
yeah, I can see that. And I guess you can see at the forefront, you know, new technologies that are coming through. Is there anything that, you know, is just on the cusp, you know, well, any of it helping, I guess?
I mean, not so much on the cusp, but we've just, certainly with COVID, one of the things we did see was drug manufacturers were suddenly making new treatments available. So for our breast cancer patients, instead of them having to have 2 intravenous injections, they're now having a single subcutaneous combination injection. So instead of being in hospital for 2 hours every 21 days, you're in hospital maybe for a 15-minute appointment. So it's things like that, you know, it's looking at things which really impact patients and, you know, trying to offer them the best treatment, but also the best treatment without having a major impact on the rest of their life. So, and I think those changes are going to continue, because it is very much about people living with cancer rather than cancer being a short-term treatment. It is about just managing your cancer. So
yeah, I mean, if you can make someone's life, you know, that much easier for them, and like you say, that monthly chore of having to go in and spending the time and wasting, you're helping them out, aren't you?
Yeah.
Absolutely.
Yeah. Well, I mean, Carrie, back to you. I mean, how innovative do you think you are as a team? I mean, for me in my old, you know, life of sport, you know, it was all about innovation and that research, that development and stuff. You know, how important is that when you're working in a pharmacy?
Very important. And I think as a team, we are very innovative. As you said, so I'll come at it from an education and training perspective. So we've started, we've got quite a few new posts that actually have never been done in, I don't think it's been done in the country yet. So we've just spoken to we've just got some funding from HVE to do a clinical academic post. So it's a split post for a year where they'll do, the successful applicant will do research for 6 months of the year, and they'll come and work and actually implement that research into their clinical practice. So that's a pilot scheme that's never been done before. So that's really exciting. And we're looking to try and get some pharmacists into the wider hospital operations team, which again hasn't been done yet. And there's just loads of opportunities as well, trying to integrate the hospital team with the GP services and the mental health services as well, which is a totally new frontier for pharmacy. But not just the pharmacists, we want the technicians to do that kind of cross-sector placement and stuff. So from a like workforce development point of view, it is very innovative, as well as then the technologies that we've been doing. You know, we've got electronic prescribing, and the pharmacy team heads up that. So that's really exciting, and it was very helpful during COVID. We were able to do kind of a split, reduce footfall on wards, but also continue that support for the wards. And yeah, as the front slide said, we've got a robot that helps us with dispensing. So loads of innovative things. And I think the potential for future innovation and opportunity is just huge in pharmacy, in the RUH and as a career.
I was going to say, do you ever sort of buddy up with other teams, I guess, from other hospitals and share ideas and kind of buddy up in that kind of way?
Absolutely. So I have a networking group with all the other education leads in the Southwest that I meet with every month, just to kind of make sure we're all doing not the same thing, but we're all on the right track for the training that we're providing, and we're providing that high standard of training. The other thing that I have to give to this team as well is that I work as a lecturer at the university. So I bring that into here, and I bring the practice from the RUH into the university and that education standards. So yeah, definitely collaboration is a massive part of my role.
Yeah, come back full circle. And I mean, Uzo, for you, you're you know, I guess very involved in that, and you also received some recent funding, didn't you, from a very kind and a generous local supporter. Are you allowed to tell us how much you received, and what are you going to be doing with all that money, and you know, the importance of it and how it's going to help you?
So I'm not sure if I'm allowed to share, but I will anyway. So we received in the region of £80,000 for innovations to broadly put, improve the patient pathway and improve patient care. And I think how we're looking at it is very much linked to the things that Carrie spoke about, because what, you know, from my point of view, and I think along with the organization, it cannot just be, you know, senior managers coming and saying, do X, Y, and Z. And it's, how do we equip all our frontline staff who, at the end of the day, see the problem and know the solutions to actually improve their bit of the process. So everyone improves their bit of the process, the whole process improves. So Carrie mentioned research. So for instance, we've participated in the COVID vaccine trials. And this year, really, we're being supported by research and development. So anything to do with, you know, practice and frontline work and almost implementing that into day-to-day practice is supported. So one of the first things that we're doing is, the first thing that we're looking to acquire, which I think is already happening at the moment, is a pharmacy tracking system. And many of them just look at what's happening in dispensary. The one that we're looking to acquire will link everything from clinical trials to the aseptics units, to the cancer center, to the wards, to the dispensary, so that all those systems are talking to each other and visible to our nurses, so that at every point in time, everyone should be able to see, if we're talking about medicines, where that is. And for me, I think the other bit about it, which I guess is one of my priorities in my line of work, is that will also talk to the quality management system that we're putting in pharmacy. So I am very keen that we get to a point where we're able to, you know, say as a whole service, as a whole trust, this is how quickly or how many of how we do whatever we do, but also this is the quality at which we do, because those things go hand in hand. Yes, we try to do everything as quickly as we can, but it's also really, really, really important to do it as safely as we can. So for me, that's sort of the first step. The trust has supported us to train a lot of our staff in improvement, in quality improvement. And, you know, I hope Carrie and Rosie will agree with me. I'm an absolute disciple of giving people the tools and the data to improve what's around them. So, you know, I think there's some Richard Branson saying somewhere about looking after your staff and your staff's looking after you, or something like that. And I start and finish at developing people.
Yeah.
So the first thing is the tracker. The second thing, we're looking at versions of our robot, but on wards. So getting all the medicine supply as close as possible and as early as possible in the process. So I mentioned that, for instance, we have one of our new roles this year has been a pharmacist in the emergency department. And, you know, at those front door services, we're really looking to push ourselves out there and basically integrate better with the hospital. You know, what most people don't know is that your pharmacist is not just the person that does medicines at the end. They're almost through the whole process. And, you know, you may notice that Rosie and Carrie are wearing it's about that recognition and, you know, knowing who your pharmacist is on the ward, knowing who you can ask about your medicines. So, you know, yes, we might talk about the technologies that are being, if you like, that we're being, I'm very grateful that we're being supported, but there are all these little building blocks that need to be put together, I think, to, yeah, get us to that service of the future where we want to be.
Yeah, no, I mean, it's so fascinating, and kind of linking in with that, actually, one of the questions that we had come through, you know, we typically, the pharmacist that we know is in our white lab as we go and pick up our prescriptions. Someone has actually asked how many prescriptions are actually filled and sort of filed every single year. Just to give us a context.
I will raise my hand and say at this point, I do not know. Because we are, and to be honest, before the end of this call or within the 15 minutes after this call, I can do a huge data grab and get a figure. But I guess to give some context, we provide medicines through what goes on the ward, what goes on in dispensary, what goes on in our pharmacy and our outsourced pharmacy, and what goes on in the aseptics unit. So there are very many different lines of, if you like, supply. So yes.
Impossible to answer.
You know what? I'll get you an answer. If it's the last thing I do, I'll get you an answer.
I can put it into slight context in the fact that if I'm covering 2 wards, I'll probably see, so each ward has got 30 patients on it. I'll probably see, out of those 30 patients, I'll try to see all, or 60 patients, I'll try to see them all. Say they've all got 5 drugs on their charts. So what's that, 6? So that's 300 items that I will pick a prescription for every day.
Wow. Yeah, I mean, that's absolutely incredible, isn't it? And like you say, that's just 2 wards. So yeah, absolutely huge. I'm going to come to you, Rosie. Another question that's come on through. What 3 qualities do you think great pharmacists have?
I think the top one has to be, you've got to like working with people, because you have to work in a team. I think in pharmacy, you can't work in isolation. It doesn't matter whether you're on the ward, in the department, you have to work, you have to be able to work as a team, and you have to be able to respect everybody else as having a valuable role. So, you know, you can't think you're special as a pharmacist. You're just one part of a team. So that's one of them. I think it's really important to have, on a practical level, you've got to have attention to detail. You know, it's really important, if we're looking at prescriptions, that those prescriptions are right. So attention to detail. Third thing, I think you've just got to be quite calm, level-headed. You just, there are times when it's really busy. You just have to knuckle down and get on with it. There are times when you've got a difficult thing to deal with. You just have to get on with it. You know, you look at the support around you, you use the support around you, but you just have to stay calm. So those are going to be my 3 things.
Yeah, brilliant. No, I think that's definitely, you can see already how much of a team you all are.
The other guys probably disagree with me and are probably going like, no. Rubbish.
I'm sure they're not. We have got final questions come in, but I just saw that someone asked a little bit earlier, and their question, Kieran said, how much longer will the Bath Racecourses vaccine programme be supported by the RUH? I actually had mine. I've still got a very sore arm from my first jab on Sunday. And I have to say, I mean, it was incredible being up there. The organisation, the way it was run was top notch, 100%. Is there, you know, an answer to how long that will go on?
It will be supported for as long as it's there by the RUH, because one of the, my understanding is one of how it was commissioned was that we're the organization directly responsible for it. So, you know, what we constantly do up there is we support them in the supply of medicines up there with the quality assurance of the vaccine. And, you know, so as long as it's up there, And let's be honest, this is a critical time in all our lives. As long as it's up there, it will be supported by the RUH.
Yeah, no, that's good to hear. I mean, it's just been incredible to see and witness it. I guess really from one of the last sort of questions from the chat, and please, if you have got burning ones, please do write them down. And this is for any of you. Do you have any stories that you can share with us about how the innovations in your department have then personally benefited a particular patient or a group of patients at the RUH? Any of you at all? Sorry about my cat, everyone. Any kind of stories that might you have directly?
I'm not particularly exciting, so I'll take a bit of a bird's eye view here, but electronic prescribing has been absolutely incredible. And it's one of these things that most people just think electronic prescribing, you know, we don't need to use paper anymore. But everything from how it helps us spot particular errors, from how it alerts you when you're giving patients, you know, when you're giving out the wrong dose or too many, how it connects people, just the safety benefits of it are huge. And, you know, it's one of those things that's so big that most people just don't see it anymore. But what is your cat called? If there was one to point to, and you know, obviously you can point to the robot as well. Carrie, Rosie, please pitch in. But you know,
I think I'm with you on electronic prescribing. I think it was a total game changer. And if you look at COVID, I'm not sure as a pharmacy department how we would have managed COVID without electronic prescribing, because it allowed people to work from home and still be able to do their job. So I think kind of a game changer really was electronic prescribing. And we've been using electronic prescribing in chemotherapy for quite a long time. The significant change there meant that we could actually read the prescriptions, because, you know, the old joke about doctors' prescriptions, well, you know, it's definitely true for some people's handwriting. I think, you know, there is some beautiful handwriting, but give us an electronic prescription and it takes away that risk. So I think we'll all give a thumbs up to electronic prescribing, although I think at the time of implementation, everyone was holding their head in their hands thinking, we can't possibly do this. Give me a prescription chart back any day. But I think we've got over that hurdle now.
And I think even with electronic prescribing, so if we're looking at the future now, you know, I think what it also does is that it means that you can look at all this data together, bring, you know, scientists into the room and do research on what is the best way for, you know, what is the best way for us as a service to go out there and do our work so that we give the most people the most benefits. And so, you know, we're working with our IT department, we're looking to work with the university on just, you know, what we want to be is to be the hospital that defines what good practice looks like. Electronic prescribing, it does give us that opportunity. So we'll see.
To be fair, you've answered Rob's question. Rob Appleyard had said, are you relieved about the technology and not having to battle with handwriting anymore?
Yes.
Yeah, the answer is yes, Rob. Now, Abigail Anderson has also asked, what is the most amount of wards that a person has been in control of? Good question. If anyone's got, and also she wants to know what are the pros and cons about working from home, which don't know if that's maybe, well, kind of armed. I mean, you guys are still there in the hospital. But
I'm happy to talk about the ward one. So it depends. So on a weekday, the max that we would probably try and share between us is 3 wards. You wouldn't, I suppose, you wouldn't be able to see every patient on all 3 wards, but you'd be able to kind of prioritize your patients, and they probably would have been seen the day before, so that's how you prioritize. On a weekend, we normally have 3 pharmacists, so we cover the whole hospital. So that's how that works. And we do all the supplies and any questions and discharges and questions for the whole hospital. So there's 3 of us.
Okay.
Everyone.
That's answered. Yeah, that's great. There's quite a long question here from Jasmine Cheesewright. So she says, "Hi from Nuclear Medicine. We would be interested in hearing about radio pharmacy and how it's been developed. When can we expect to be able to receive radio pharmaceuticals from you on site? At the moment, we have delays in seeing patients while waiting from deliveries from other sites." So if that's a question you're able to answer.
I'm happy to take that one. So we had planned for a June go live, and this, I would probably say that radio pharmacy is our #1 priority from an operational point of view. I guess, Jasmine, I think if just for full transparency, so there are two things that are happening now that have caused this delay. So now we are looking at July, August go live. So the first thing is the same team that's putting radio pharmacy in place is also the team that's doing the quality assurance at the vaccine site. And I think one of the things if you like, what is our job? It's balancing different priorities. So the second one is that we have a massive, the regulatory agency is coming to inspect us in about 14 days. And I'm not even going to pretend I'm an expert, but I understand that a huge amount of preparation goes into that. And we have to do well on that inspection to actually be given the go live for radio pharmacy. So for anyone on the call who doesn't know about radio pharmacy and how what the project is, so we are looking at going live with a radio pharmacy unit in here. So if I'm not mistaken, and please feel free to correct me, we use radioisotopes.
Technetium.
Thank you, which are used by Nuclear Medicine for certain types of scans. And obviously, given that there is a huge drive towards recovery, we need to build that capacity. At the moment, we order it from other hospitals who have live radio pharmacy units. But as was mentioned in the question, when we can go live here, our teams can come and start at 7 in the morning so that we're ready and able to do scans from 9 o'clock. And for us, it's a hugely ambitious project. It's one that's been going for a while, was supposed to go live last year and then COVID happened. And yes, believe me, I can promise you, we are doing absolutely everything we can on this, but we are looking at the next couple of months.
That's brilliant news. You know what, it's been fascinating speaking to you. Thank you everyone for all the questions. Unfortunately, time has now rolled away. It always vanishes so fast. So, for me, I feel like I've learned so much from the three of you. I definitely think about, your whole pharmacy department very, very differently. Unfortunately, we don't have any more time for questions, but if you do want to find out about any more of the panelists and anything, please contact the website or Maddie. Her email is maddie.jones@nhs.net. One of the questions was, what is the name of my cat? And he's called Cat. And, he's actually been very well behaved today, but he's get in on it. But yeah, thank you so much, Carrie, Uzo and Rosie, for joining today. I wish you all, the best for the oncoming months and years, and I'm sure we will meet again. So please, to anyone who's been here today, if you want to support, in any kind of way, please do get in touch. And I want to say thank you so much. Cheers, everybody.